Hi everyone, we're back for our second episode, and today we have new members. Would you guys like to introduce yourselves?
Hi, my name is Sharvi, and I'm super excited to be here.
Hi, I'm Shanti.
So today in our episode, we're going to be talking about CAR T treatments. And basically, CAR T therapy stands for chimeric antigen receptor T cell therapy.
Yeah, and a bit of background information about CAR T cell therapies is that it doesn't work for everybody, but for some people with very advanced cancer, it could completely erase their disease for long periods of time.
Like for people who haven't been able to eliminate the disease, it can be used as like another option which has been shown to actually like get rid of your cancer and make sure that it doesn't return.
It's called a living drug, and that's because it uses the patient's own T cells to fight the cancer.
Yeah, so a quote, T cells are the backbone of CAR T cell therapy, and because it uses T cells collected from the patient with this form of treatment, we are giving patients a living drug, which is explained by Renier J. Brentgens, a PhD doctor of Roswell Park Comprehensive Cancer Center of Buffalo, New York.
The T cells are like taken out of the patient's body, and then in a lab, they get genetically modified, and they add like these special receptors called CARs, which is the chimeric antigen receptor. And these like supercharged T cells are put back into your body so they go after the cancer.
So in case you don't know what a T cell is, they're a type of white blood cell that are essential to your immune system, and they're basically trained to identify and destroy invaders like viruses, bacteria, or even cancer cells in this case.
Yeah, and this process is usually takes like around several weeks, and the outcome is usually positive.
So the first step is leukapheresis, where blood is drawn from the patient and a machine filters out the T cells, and the rest of the blood is returned to the body. And so through leukapheresis, a catheter is inserted into the patient's veins, and the blood runs through a machine, and it takes out the T cells.
Yeah, and that collected blood from the patient is sent to a treatment manufacturer's laboratories where they're used to separate out the T cells.
So they put a gene into the T cells that instructs the special receptors on their surface called the chimeric antigen receptors to recognize antigens only found on cancer cells.
Yeah, so basically each chimeric antigen sits on the T cell membrane with part of it inside and part of it outside the cell. And on the external part, it's composed of fragments of lab-made antibodies, and then in the internal part, there's a signaling domain, and after the receptor binds to the antigen on the tumor cell, which is the cell you're trying to eliminate, the signal is transmitted inside the T cell, which helps multiply them further in the body.
Yeah, and like Serena was saying, this whole process takes around 3 to 5 weeks.
So in those 3 to 5 weeks, the engineered T cell grows in the lab, and it goes through mitosis, and it creates hundreds of millions of copies.
Mm-hmm. And then if all goes to plan, it will go back into the patient's body and expand and kill any cancer cells that have the target antigen on their surfaces.
So the way it kills the antigen is that when the CAR binds to the antigen, it triggers the T cell to release this cytotoxic molecule like peripherin or granzymes, which destroy the cancer cell from within. And then the CAR T cells also multiply in the body and continue patrolling for any leftover cancer cells. And sometimes the cells remain in the body for months or even years, and that gives long-term protection.
The only bad thing about it is there are some side effects which Ellen can expand on, but they could include infection or a mass die-off of antibody-producing B cells in your body.
For example, like what Shanti was saying, a lot of infections and then mass die-off, which also include cytokine release syndrome, which means that the infused T cells flood the bloodstream with cytokines and chemical messengers that stimulate the direct the immune response. Another symptoms of these huge amounts of cytokines can bring dangerously high fevers and big drops in blood pressure. It could also lead to be very fatal.
Thankfully, cytokine release syndrome can be treated with an IL-6 blocker called tocilizumab and steroids. Another side effect is ICANS or neurotoxicity, and it causes confusion, sleepiness, and slurred speech.
Yeah.
It can also be treated with steroids or anakinra.
Yeah, and ICANS stands for Immune Effector Cell-Associated Neurotoxicity Syndrome. Serena, do you want to expand on like personal experiences of CAR T therapy?
Yeah, sure. So, an real-life patient story would be Nick Howe, who was a 35-year-old, like, around 5 years ago, and he has been battling, like, large B-cell lymphoma for 4 years, and the standard treatments didn't really work for him, so he signed up to be one of the first patients to be part of a clinical trial for the CAR T therapy back when it was still, like, in experimenting, and only 3 weeks after his treatments, doctors said he was clear of cancer, but, like, still years later, Nick, like, still goes to the hospital to undergo testing, like, once around, like, every 3 months to see if he still has symptoms or signs of this cancer. And, like, even his oncologist said that he wouldn't have been able to be here if it wasn't for his treatment. So this is, like, a really spectacular advance.
Yeah. There was a study in one trial with people with advanced follicular lymphoma. CAR T cell therapy eliminated the cancer in 80% of patients in the trial, with the disease not returning within the next 3 years, which is like really amazing.
Yeah, that's amazing. And a few FDA-approved CAR T cell therapies include Absema, which I don't know if I'm pronouncing these correctly, Absema is a CAR T cell therapy, which targets multiple myeloma cancers, and then also Aucatzyl, which targets B-cell all, which goes for all adults. And then Breyanzi, which targets follicular lymphoma, and etc.
And the great thing about this is that it is just as safe as an option as any other treatments. And in many hospitals, including one Mayo Hospital, Mayo Hospital like offered it as a clinical test trial for the treatment, and 117 patients enrolled themselves in it because, like, usually this treatment is used as kind of like a backup in case, like, chemo or, like, any other treatment doesn't work.
Yeah.
Like Ellen was talking about the FDA approving, the first ever one was called Kymria, and it was used to treat ALL, which is acute lymphoblastic leukemia, and it's the most common type of cancer in children. And like sometimes even after multiple rounds of chemo, leukemia comes back and it never fully goes away. But Kymra basically reprogrammed the T cells to recognize CD19, which is a marker on leukemia B cells, and it destroyed them. And it was really, really successful.
Yeah, what Sharvi was saying was about ALL, which is an acute lymphoblastic leukemia, is basically a type of cancer in the blood and bone marrow, and like she said, is really common in children.
Yeah, and so with all of these successful like CAR T cell therapy experiences, we can now talk about what's next for CAR T cell therapies. And something I can start off with is I know that CAR T cell therapies that have fewer effects can also be used for any type of blood cancer, and that's what scientists are trying to look towards. Scientists are also looking towards things like T cells coming from healthy donors instead of patients, which then can be made in advance and available for anyone as soon as possible.
As of currently, this treatment costs around like $373,000 to $475,000, which is a lot for like the average patient. And this number doesn't even include like other surrounding treatments like doctor's appointments, tests, or prescriptions. But recently Medicare announced that CAR T would be covered.
I feel like CAR T cell therapy is like one step closer to us getting to the cure of cancer, which I feel like has been the kind of like the phrase you've heard since a kid, like, oh, I want to cure cancer when I'm older. I feel like we're so close to that now.
Yeah, it's definitely a great new advancement. And as time goes on, it's going to improve so much more and become more advanced.
Yeah, so that wraps up our episode about CAR T treatment.
Yeah, so thank you guys for listening, and please tune in for our next episode. Bye.